Kimberly Mayer, normally here with us, the Associate Director of CIBHS, will not be joining us this afternoon. I will be doing the moderation. I'm Lisa Smooze. I'm the training consultant, and I'm going to go ahead and throw it over to my co-moderator, Kristen.
Oh, hi, I'm Kristen Dempsey, and I am the project manager for the Greater Bay Area Mental Health and Education Workforce Collaborative, and I look forward to moderating today.
Hi, I'm Kelly Betts, and I am the program support person on this team.
Great. So now that you've met the team, let's take a quick overview of what we're going to be talking about in our webinar tonight. So we're going to start out with those three polling questions that I told you about at the beginning. We're going to find out a little bit more about you so that we can make sure to customize future trainings and our responses so that we meet the needs of the participants here today. Then we're going to do a mental health career overview. Then we're going to talk about jobs that require lived experience, jobs that require additional training and education, and then going back to school, sort of the ins and outs of that whole experience. Then we're going to pause for our questions and answers, which is when we will read back any of the questions that were typed in during the entire webinar today. So feel free to go ahead and type in questions as soon as they pop in your head. We don't want you to forget those. Know that they will be held by Kelly in a queue as they are received, and we will go ahead and read those at the end. All right, so we're going to go ahead and start with our very first questions, and Kelly's going to pull up a poll that you can actually respond to live. What we'd like to do is get an understanding of our audience today so that we can customize our future trainings and our resources to best meet your needs. Of course, as with all the activities in the Peer Leadership Institute, you always have the right to pass. We want to hear from you, but we want you to take care of yourself and participate at the level that feels comfortable to you. So we're going to have 3 questions that you can respond to in real time, and we'll be able to see those results. And this is going to give us a better sense of who is in our group today. And so first, we'd like to hear about your career interests. Now, I know some of you may be in a room where you have one monitor and multiple participants, so go ahead and check all that apply. Now, if you are sitting there and you have more than one participant in the room, we do need you to type in the number of the participants and the organizations that they work for, as well as the county that they are in. Those 3 bits of information do need to be entered into Kelly in that dialog box if there are more than one participant in the room today. So go ahead and answer the first question. What type of career are you most interested in learning about today? And you can select one or more of the following. If you would like to learn more about continuing as a peer support worker, becoming a certified peer specialist, becoming a case manager or some kind of related position, or becoming a licensed clinician, go ahead and let us know which of these you are most interested in learning the most about today. Okay. I think we're ready to go ahead and see the results then, Kelly. Okay, so it looks like we've got about half of you that are really interested in just continuing to grow in your peer support worker position. Also, 33% of you about this possibility of a certified peer specialist. And then another 33% looking for case management or related positions, and 17, which is a significant piece of the population, looking to become a licensed clinician. So knowing that, we are going to touch on all 4 of those areas today, and we'll also be prepared to answer questions at the end about any of those if you don't get the information that you're looking for. Let's go ahead and go on to our next question and find out a little bit more about you. This time we'd like to learn more about what kind of educational experiences you've already had. So what is the highest level of education you've already completed? Some high school graduate, vocational school, or some college, a college graduate, or do you have an advanced degree such as a master's, PhD, PsyD, or MD? Go ahead and take time to answer, and you can always select one or more if you have more than one in your group today. Might take about 5 more seconds. All right, Kelly, can you pull up the results? Okay, so it looks like the vast majority of our attendees today have gone to some college or done some vocational school already, so that's really interesting. And several of the jobs that we talk about are aimed directly at that level of educational background, so that should be of interest to the majority of the group today. Looks like we do have some folks that had a high school experience, others that are high school graduates, and others that are college graduates as well. So there will be information for each one of those levels. All right, we're going to move on to our very last question, and we want to hear a little bit about what your future plans might be. So this is sort of future education and training. Tell us a little bit about any training that you'd like to pursue. So you don't want any additional training, that's an option. Interested in maybe doing the peer certification process, community college certificate or degree, a bachelor's degree, graduate degree, and licensure. I'm going to take about 5 more seconds and get a few more responses in there. Okay, Kelly, if you can go ahead and pull up the results, see what we got. Wow, okay, interesting. There isn't a single participant that responded that doesn't want some kind of additional training. So we are definitely going to spend some time of our webinar today talking about how do you go about getting those additional training and education experiences that you're looking for. Lots and lots of folks, 86% are really interested in this peer certification process, and Kristen does have some information about that, and I would encourage you to also register for our next upcoming webinar, which is completely about the peer certification process. The community college certificate or degree, another huge amount in this audience, 71% of you looking to perhaps pursue that education. 43% looking for a bachelor's degree, and 43% looking for a graduate degree and licensure. So we're going to spend some time today talking about how do you get into educational institutions, what are the paths for that, and also how to pay for it, which is always a concern for everyone. All right, thank you so much for your time and for giving us your responses. That's really helpful so that we know where to spend our time today. So we're going to go ahead and move along here. We're going to talk a little bit about what type of careers are available in mental health in general. So mental health, as you know already, is a broad field with a wide range of career choices, and it can involve working with individuals with mental health conditions and supporting them in recovery, counseling individuals and groups to help them do better at school or work better in their personal relationships. You can advocate for people's access to mental health and other human services, and you can advocate for policies that affect mental health, reducing stigma and discrimination, all types of different roles. People who work in the mental health field can work with individuals or groups, and you can do this with all ages, children, adolescents, adults, older adults, and with many different types of mental health challenges, including addiction, substance abuse, problems with self-esteem, family, parenting and marital issues, grief, anger, depression, trauma. There's all types of different issues that you could choose to work deeply in and specialize in. Some mental health practitioners, professional counselors, psychologists, psychiatrists, clinical social workers, and psychiatric nurses, they hold advanced degrees that have specialized training. Others may obtain a certificate or on-the-job training, while still others use their lived experience as the primary qualification for their work. So it's a very vast field with a lot of different opportunities for a lot of different kinds of people, and you can find work in just about every interest and education experience level. It really just depends on where you want to go with your career. Sorry. Now, the question really is not are there a lot of mental health careers out there, but really is a career in mental health the right fit for me? So the people that tend to do really well in mental health are people that have strong skills and traits in the following areas, like excellent listening skills, and we talked about that in our first in-person training. Advanced verbal and written communication skills are very helpful. Having empathy and compassion towards others is essential. Possessing clear, healthy personal boundaries can be very helpful for avoiding burnout and having satisfaction in your role. Belief in people's capacity to change, I would argue, is probably the most principal critical thing that you need to have. Comfort with ambiguity, because it comes up a lot. Critical thinking skills, being able to be non-judgmental, the ability to be discreet, authentic, and self-aware, and the ability to recognize and seek out help when you need it for yourself, which isn't something that is talked about in a lot of training programs, but is really important. So it's not all roses all the time. There are challenges, just like there are with any type of work. Some challenges of working in the mental health field can include work that requires a really high emotional investment, which can leave you not with a lot of emotional energy for your personal life. That can be a challenge. Some jobs and settings are not highly compensated, and that can be a challenge for people trying to make a living in a very expensive part of the world that we live in. And there is potential for burnout in our profession. There are also benefits, obviously, of working in the mental health field, including opportunity to help people, which is why many of us go into the field and make a difference in their lives. And, in general, work environments are committed to support relationships and work-life balance. In general, that is a value of our field. But, these are all just general rules. Every position type and every setting is very unique in this field. So let's take a look at some of the specific positions and find out what they do exactly and what they require so you can get a better sense of what might work best for you. So first we're going to talk about jobs that may require lived experience. So peer support services, as all of you guys know, are a great way to get involved in the mental health field if you have lived experience and you want to use those experiences to help others. There's many different opportunities for peer support workers, including focuses on parents, families, adults, older adults, and youth. Now, most people become a peer support worker after having received services themselves or having assisted someone that they care about with receiving services. So after their personal experience, these individuals sometimes find work opportunities in the places where they were formerly being assisted, or they find work through other advocacy or support groups like NAMI. Most positions start out as volunteer work, and some of those then evolve into paid positions with increased responsibility. That's sort of the more informal path to peer employment that's been going on in California up until now. So we're going to take a look at a little short film about one person who took this path to becoming a peer support specialist.
I was having trouble with depression, and I went to the emergency room, and they cared for me and sent me on to basic vista, and that was really hard for me to experience. She came in and talked to me like a normal person. It kind of gave me a spark of hope that I never had before. So it was kind of neat to have that happen to me. And she helped me all the way through the time I was there. And I felt that that time I could do anything. And that's when I went into the peer support group. And that group just kind of got me going. Now I am a peer support person who works in the ICU and have had lots of dealings with different people and different problems. For me to tell them that I was once here, and they just look at you like, really? I can't believe you were here. I walked by and she goes, can you hold my hand? And she goes, I just need somebody to hold my hand. And I go, would you like to go to group? And she goes, if you hold my hand. Connection. Connection. Just like I was treated. I want to share that love and kindness.
Okay, so one person's perspective of having joined the field as a peer specialist after having her own personal experiences and kind of the traditional path that we've done that. And of course, there's pros and cons to having this more informal career path that we've had. One benefit is that it allows for a great deal of flexibility and allows each setting to hire people easily and quickly, getting them right into the workforce with no, educational or experiential requirements of the peer support worker. Some challenges, though, that have arisen is that the peer support worker may feel unprepared for their new role, or the employer may not really have a clear sense of what role a peer support worker is best suited to do and the best way to utilize the position and set the person up for success. So some of those challenges, along with other challenges related to billing for services, are some of the reasons that California is now moving toward creating a certification for peer specialists. And to talk a little bit more about that today and give you a brief overview is Kristen Dempsey. And then, of course, don't forget to register for our next webinar that I mentioned earlier, which will delve in more depth. So, Kristen?
Yes, thank you, Lisa. I have 3 slides here, and just about the peer certification process so far, and actually it's more about what's in the content of the current legislation that actually was introduced in February and has passed the Senate in California and is in the Assembly. And right now it's at the Appropriations Committee, and basically those are the folks who are kind of figuring out kind of the money piece around some of this. And once it gets through the Senate, it's pretty much on its way to becoming a law, which is, through the Assembly, it's getting closer to becoming a law. So we hope to have that happening within the next several months, but as you know, some of these things can take time. What's really important, though, is that this is actually in process, and there's been a lot of support around it. Our next presenters, our next webinar, will talk more in detail, but I have 3 slides here just to kind of give you some ideas, because these are things people ask a lot, and I'm really glad we included these slides because, as we found out from our polling questions, so many of you have interest in this, and it makes a lot of sense because it does help increase legitimacy and chances of being billable and being able to have a certain consistent process in how people get educated. So one of the things, and I'll just summarize a couple pieces for the slides, is it requires, if this were to actually become a law, the Department of Healthcare Services, that's what DHCS stands for, to establish a peer parent transition age and family support specialist, peer support, by July 1st, 2017. So it would have to do the following, and the following are all the different pieces I have in the bullet. There's certainly more to the legislation than what I have here, but this gives you a good taste of it. So we want to be able to establish a certifying body that, of course, gives legitimacy and creates consistency and improves the quality of the kind of education and certification people go through. And what's also, I think, very cool is that they're really looking at the different categories of and different types of peer support specialists as issued and kind of determined by the Centers for Medicare and Medicaid Services. So that includes adult peer support specialists, transition age youth peer support specialists, family peer support specialists, and parent peer support specialists. So that's really important because that gives people in the field some variety and can help them decide how it is that they would like to train. And I'll go ahead and have the next slide, which talks a little bit about the utilization of best practice material. That's actually another piece that's really important, is that you would really be looking at, in terms of certification, like what are the best practices? And this is really helpful because we already have a lot of best practice. We've done a lot of research. Over, I think it's 37 states have certified peers, so we have some pathways. And so really we want to look at what are the best practices that have been established, how to keep those going, and then to figure out, our range of responsibilities, practice guidelines, curriculum and core competencies. So you could then really get a sense that if you go to different training programs and they help prepare you for certification, those training programs have to be creative and have to be responsive to what's in the certification. So it really helps make the training more consistent and really maintains the quality. And then there's also, we'll determine like what would be the overall training requirements, a certification would, so everybody has kind of a consistent expectations. And that will also look at continuing education. So that is after you're certified, you would have to go through and every now and again get some additional classes and ongoing education, which is actually very helpful because it keeps your skills up and it helps add to your knowledge base. So I'll go to the next slide here, so last slide on this particular piece, which is it'll also help determine like what are some of the clinical supervision requirements. And for those of us working in the field, and I may include many of you, know how important clinical supervision is. Because when you're out there and you're doing the work, this can be very challenging work. And like Lisa was talking about, there's an important piece about self-care and self-awareness and safety, and are we doing the best practices, and is this the right way to do it? It's exciting work, but part of what makes it exciting is the complexity and challenge. So supervision is really important. So to be able to know, like, well, who would be a supervisor and how are they qualified? Because you want to have people who are really qualified and helpful be supervisors. A code of ethics, which, you know, we've already made a lot of recommendations around a number of different agencies, but there are a code of ethics in terms of what is considered moral, ethical, responsible, safe behavior. And having certification helps keep people to that behavior. It also determines the process for certification renewal and revocation. And this is one that many of you will be interested in, is that this legislation will also determine a process for allowing existing personnel employed in the peer support field to obtain certification under this article. So a number of people have asked us, and we'll probably learn more about this next week, what are the options in terms of the idea around being grandparented? Like if I already have a certification, will I be able to automatically get, or if I already have education, I should say, will I already get automatically certification when presumably this bill becomes a law? And so they need to determine what that's like and what that will look like. Different types of training and different types of certifications and licenses have their own process for this. So that's to be determined, but what's really important is that they're actually considering that that's actually something that's going to be considered as they think about this.
Awesome. Okay, thank you so much, Kristen. So for everybody who's interested in that, stay tuned for the next webinar to get a lot more detail, but hopefully that gives you a preview. So another way that you can get involved with the mental health field and really utilize your lived experience in a meaningful way is as an advocate for mental health issues, for policy, services, that type of thing. These are opportunities that are great for people who are interested in public policy and government. And while lived experience is not a requirement to participate in advocacy work, the ability to share a compelling personal story that relates to the issue being discussed can be a really powerful skill that enhances your ability to be successful in this arena. There's many people and organizations that are dedicated to advocating specifically for policy change. And many people begin their career in advocacy by joining one of the groups as a member or a volunteer. And that builds valuable relationships, and gradually, you know, it helps you to learn about the issues. And when you find what you're most connected to, then often you can move into a position within that organization that you were volunteering at to do advocacy work on those topics. And so I've got a few listed on the screen, some of the agencies that are in the state of California that do advocacy work. So Mental Health Association of California, I'm sure everybody's familiar with NAMI. There's Disability Rights California, CMACI and CCY work specifically with youth, and of course there's many, many others. So now we're going to take a look at jobs that require additional training or education. So this could be certificates, exams, or on-the-job training. We're not yet discussing the four-year institution level training. So many people interested in finding a profession in the behavioral health field have circumstances that make going back to school for 4 or more years a bad fit. These next professions have qualifications that can be met through certificates, exams, or on-the-job training. There are many other types of certificates and specialties that we're not going to talk about today, so such as like a wellness recovery action planning facilitator, things like that. Those can be obtained and are useful in enhancing your career options, but the following professions are recognized by a formal certificate given by the state of California. So we're going to go ahead and go to those. So the first one that we're going to talk about is the Psychiatric Technician. And the Psychiatric Technician, you have to complete a program that is related to the Psychiatric Technician profession, specifically for that. It takes about 12 to 14 months full-time, or 18 to 20 months if you're going part-time. And this is going to encompass also 1,530 basically practicum clinical hours of actually doing experiential work. The average salary for that runs $35,000 to $45,000 a year annually, and of course this varies really widely on where you're being employed. You know, as we know, like salaries in the Bay Area tend to be higher than in the Valley, that type of thing. And you can get some additional info by this link here, but you don't need to jot that down. If you have that great handout that Kelly made, it's actually on there. So these folks actually work under the supervision of psychologists or psychiatrists. And we'll talk about what the difference between those is in a little bit. They aid the doctors by carrying out treatment plans, administering medicine, conducting counseling sessions, maintaining patient records, etc. Patient technicians often work in hospitals, nursing homes, and rehab centers. So if working in a hospital setting appeals to you, this might be a path that you could do without having to do some of the more lengthy educational training programs that usually are required in that setting. Another certification we're going to talk about is the Certified Psychiatric Rehabilitation Practitioner. It's referred to in short, you'll hear it in all of the acronym world, it's CPRP. That's what this stands for. So individuals of all different backgrounds can achieve the CPRP. So currently we've got CPRPs that are also MDs and PhDs, and we have people who are CPRPs that have gotten their GED from high school. We've got people who are working as occupational therapists and peer specialists, social workers and caseworkers, but the common core is that they all share this commitment to the fundamental principle that recovery from serious mental illness is possible. So candidates for the CPRP have to meet eligibility requirements in 3 different categories, and one is academic preparation, and you'll see that that's the first column there on the left. Work experience, which is called practical experience on our slide here, and that's not just any work experience, it's practical experience that's related to providing psychiatric rehabilitation in this recovery-oriented setting for adults or transitional age youth. So it's a very specific type of experience there. And then, of course, qualifying education and training in psychiatric rehabilitation. So you'll see some folks are exempt from having to do additional training. So that would be people that have already a graduate certificate or a degree in psychiatric rehabilitation, and they've been working for a specific period of time. They don't then need to do additional training. They can just go for the certification. But it varies all over depending on what your educational background is and how long you've been working in this particular field. So nearly all of them, you can see from the chart here, nearly all of them are required to complete 45 hours of applicable training. All training has to address the treatment and or rehabilitation of adults with serious mental illness. This includes topics on direct care, vocational or life skills training, crisis intervention, treatment modalities, medications, diversity, and ethical legal issues and things of that sort. So that is the CPRP. Now we're going to move along and talk about jobs that require additional training or education at the 4-year level. So this would be bachelor's level, advanced degrees, and then of course the additional requirements of licensure. So one way to get involved in the mental health field is to become a licensed therapist or counselor. These positions obviously are going to have higher education and experience requirements and involve regular contact with clients and participants. These positions can vary really widely, depending not only on your educational background, but also the specific population that you're going to choose to work with and your approach, which is sometimes called a theoretical orientation. You might have heard it called that. And then, of course, the setting you work in, like if you're in a hospital versus a nonprofit, that's going to just radically alter what your job looks like too. Now, people with lived experience can bring their unique skills and their perspective to a variety of positions in the mental health field. And you may find that the combination of having personal and educational experiences to provide this really rich background for doing clinical work. This can also help reduce stigma within the profession and inspire hope in participants to see licensed clinicians that also are out about their personal lived experiences as well. So these positions are going to require a university degree, often an advanced degree, that would be a master's level or higher, and significant experience in the field, most of which happens after you get your degree, along with licensing exams in some cases. So we're going to just take a quick look through some of these, and we're going to start by having Kristen talk a little bit about substance abuse and behavior counselor positions and what those require.
Right, thank you, Lisa. Okay, so substance abuse and behavior counselors, there's various ways to gain certification, and it's interesting in California. At one point, there were, I think, up to like 20 different bodies that would certify people in substance abuse counseling of some sort, substance use. So we like to call it substance use disorder counseling. It sounds less judgmental. It sounds a little more objective. And so there's been a number of places that have been doing that, and really we're down to kind of think about 4 right now. So the 2 I have mentioned here are CADI, the California Drug and Alcohol Counselor, and I guess that's the CADAC, and then the CADI, the California Association for Alcohol and Drug Educators. And what these are like certifying organizations, and that they have a certain curriculum and guidelines that, you know, when you meet their certain requirements, and if you go to certain programs that meet their requirements, you actually will be able to obtain one of their certifications. And usually people attend 2-year programs, or it doesn't have to be a full AA degree, but it can be, usually takes about 2 years worth of units through extended education or through certain community colleges in order to have the qualifying degree that you would need in order to have one of these certifications. One thing that's nice about this is that there's a number of treatment programs, like residential programs, even outpatient programs, that specialize in substance use disorder treatment that actually require people to have some level of certification, either the CADAC or the CADI. And how it works right now is, again, those tend to be the 2 in California that I know that are the most recognized, or there could be other certifying bodies as well. What is very helpful is if you have one of these particular certifications, it does help to allow for some upward mobility. If you get one of these certifications and you have some other additional skill sets, say peer certification comes around and that occurs, and you have this in addition to your peer certification, or in addition to a counseling license or a rehabilitation certification, it really adds, I think, a lot of desirability to one's position. And there's a number of employers who really are looking for folks with substance use disorder treatment in their background, because, as you might know, it's something that always comes up. And just in general, people in the mental health field aren't always as flexible and responsive to substance use disorder treatment. And we're really understanding that we really need to be. Another kind of cool thing about being able to get a substance use disorder certificate is that many of the programs have options. If you go to the websites that we have there, you can check it out. They have options for distance learning. So if you're in a position where it's really hard to get out or to get to a college campus, there's some things you can do online, which is actually very, very helpful as well. And then I also just kind of want to really emphasize the fact that regardless of where you maybe want to specialize, maybe you're not that interested in substance use disorder treatment, but there's some interest. You know, if you decide there's another area that you really want to focus on, this is actually one of those nice kind of additional areas or add-ons that you can get in your education that can really help build your career.
Awesome. Thanks, Kristen. All right, so now we're going to answer a question. This one is just because when I first started out in this field, I was really confused, honestly, by all of the different types of positions. You know, you hear about psychologists and psychiatrists and social workers and MFTs and LPCCs, and to tell you the truth, I was having a very hard time differentiating what was what. So we're going to spend a little bit of time just sorting out some of the major groups, because they really do unique work. And so knowing which one of those connects most strongly with what you want to do is very helpful when choosing educational programs and career paths. So in general, first we're going to talk about what's the difference between a social worker and a therapist. In general, social workers and therapists perform similar roles. But while a social worker may also be a therapist and provide psychotherapy services, the reverse is not true. So if you're a psychotherapist, you can't perform social work. So the roles are not interchangeable. If you want to enter a helping profession like social work or psychotherapy, knowing the differences can help you make the right career choices so you know which program to do, since both of these are master's level positions in most cases. It helps to know which program you need to choose. Social work is basically a profession that focuses on improving the lives of individuals, groups, communities, and society as a whole. So it has that more societal lens. Social workers perform a wide range of duties to accomplish the goal. You can choose to work as a clinical social worker, focusing on diagnosing and treating emotional problems, a direct service social worker where you help people obtain needs like foods, housing, and employment, or you can do research, conducting studies to improve the knowledge base for the profession. Social workers can also work in a variety of settings like we've been talking about, including private practice, hospitals, schools, university, substance use facilities, community centers, nonprofit organizations, even international aid organizations in foreign countries. Now, marriage and family therapists, or licensed professional clinical counselors, which is the LPCC, that's a new designation in California. It's been national for a while, but it's more new here. Those are often called therapists or psychotherapists. The word therapist is used as kind of a broad term to describe somebody who provides psychotherapy and counseling. So a therapist can be a social worker, a mental health counselor, a psychologist, a marriage and family therapist, even a member of the clergy or a psychiatrist. Therapists provide mental health services such as diagnosis, assessment, and talk therapy, which is the big one, and treatment to their clients, usually in settings such as like a nonprofit, or it can also be private practice. So that's just kind of a quick overview of some of the differences of these professions that we're going to be taking a look at. So the first one we're going to take a look at here is the licensed marriage and family therapist. That's referred to as MFT, and licensed professional clinical counselor, LPCC, and this is actually my licensure. So the education and experience requirements is you have to have a graduate degree, a master's or doctoral. Most people do a master's. And then you have 3,000 hours of supervised practice actually delivering treatment. And then there are a number of licensing exams, and those vary depending on if you do LPCC or if you do the MFT track. And the average salary, this is national, $39,000 to $50,000, and it really varies widely where you are. You can get some more additional information on that handout from that link that's also on the screen. But basically, these folks, we work directly with individuals and then also with families, especially if you have the marriage and family therapist certification. But an LPCC with specialized family training can also work with families to help resolve interpersonal conflicts, relationship problems, work performance issues, family dynamics. We also work with substance use and various other issues. Often folks work in private practice, state agencies, lots of nonprofit organizations, but you'll also find folks in hospitals and outpatient centers as well. All right, now we're shifting over to the licensed clinical social worker, which was the other part of that we were trying to differentiate. So the education is similar. It's a master's degree in general with 3,200 hours of supervised work experience, and there are licensing exams as well. The average salary is a little higher, $57,000 to $65,500, and you can find more information at that site that you see there. And basically, LCSWs address individual and family problems such as serious illness, substance use, and domestic conflict. But most of your work will be done in a clinical setting and typically encompass psychotherapy, counseling, therapy, and more. State licensing requirements vary, but some amount of supervised work experience is necessary if you're going to do private practice. So now we're going to go on to the other one that folks get mixed up, at least I did when I first started in profession, and like what's the difference between a psychologist and a psychiatrist. So a psychologist has a PhD in psychology or a mental health related field, or what's called a PsyD. It's a doctorate of psychology. So both doctorate degrees. And then it's required to have 3,000 to 6,000 hours of supervised training, half of which has to be postdoctoral. So this is 3,000 hours has to be done in California. The average salary range is higher for these roles, so $50,000 to $116,000 annually. And folks like this evaluate psychological, biological, and social factors that are contributing to mental health conditions. They often work in private practice settings, community-based organizations, public agencies. You'll find folks like these in academic institutions, healthcare settings, and some business settings as well. Now, unlike psychiatrists, psychologists do not, in general, prescribe medication in most states. There are some specific exemptions in some areas, but for the most part, psychologists do not administer medications. Psychiatrists, education and experience, so these folks have an MD, so they go to medical school, or a doctor of osteopathic medicine, which is a DO. Then after that, 4 years of residency training with at least 3 in psychiatry. Of course, they make the highest salary range out of the folks that we've looked at, $150,000 to $300,000 annually. And their job is to evaluate a patient's mental condition in conjunction with their medical condition. So they're looking at physical health as well as the mental health issues. And in most states, only psychiatrists, like I said before, and other physicians can prescribe medications. Licensed psychologists and psychiatric nurse practitioners can have some limited prescription privileges for psychotropic meds in a few states, but not everywhere. All right, so now we've talked about the professions, and we saw from our poll that a lot of you are actually really interested in going back to school. So my first message to you is, if you're thinking about it and wondering if it's too late for you, if you think you're too old for college, think again. It's never too late. I am a huge believer, this is a big personal thing of mine. It took me 10 years to ever set foot in a community college after high school, and I thought I was much, much too old at that time, which makes me laugh now. But it's never too late to start on your second career. It's never too late to pursue something that you're interested in. And there's lots of paths to getting there. So we're going to talk about how to get into a college or training program, and is there some way to help with the expense of an education? And for me, I didn't know the first thing about, I didn't know what was an associate's degree, what was a bachelor's degree, what does community college do. I didn't know anything about how any of that worked or how you qualified. And I certainly didn't have the money or the financial backing from a family to help me with the expense of it. So I thought it was out of reach for me for a long time. But actually, it's fairly straightforward, and it's really feasible for many, many people. So first we're going to talk about the different kinds of degrees you can get and the ways to get them. So there's several different paths that you can take to getting your degree. So regardless which path you choose, always make sure that you're attending an accredited university. This is a big deal. There are people out there on the internet that prey on people who really would like to get a degree but don't have a lot of time, and they give them not qualified degree programs. So a good thing for you to look for if you're looking to go to school in California is what's called WASP accreditation. So it's Western Association of Secondary Colleges, I think. I can't remember exactly what it stands for, I apologize, but it's WASC. So for many people, including myself, the California Community College offers a local and affordable means of going back to school. It's awesome. There are campuses all across California, and students can actually apply online to several campuses at once. So even the application process is really easy because you fill out one application and it goes to a bunch of campuses. Classes here are usually the most affordable of all the higher education options in California. And there's financial aid available, quite a lot of it actually. And you can apply certain coursework that you do at the community college level towards a 4-year degree. So you can get it done less expensively, get all you can get done at the community college, and then transfer that to a 4-year college. So if you don't want to do community college and you meet certain criteria, so having a certain score on your SAT, and if you've done specific coursework while you were in high school, then you may be eligible to apply directly to a 4-year university. So in California, you can choose from campuses in either the California State University system, that's called the CSU, which you've probably heard of, or the University of California system, it's a separate system called UC. And then, of course, there are lots of private colleges and options that you can do too. In most cases, you can also begin at a community college and then transfer during your junior year. That's the typical time when you would transfer. Now, in general, CSU is usually the most affordable of the options, followed by the UC and private colleges. But there's financial aid available at all of them, And that really varies. So you need to take a look at that on a case-by-case basis. And I'm going to give you a specific instance of when a private college actually is a lot cheaper than a CSU that you might be surprised by. So for many returning students, online degree programs, hybrid programs. Hybrid means that you attend some classes and then others you would do online. And a lot of times those ones that you attend are on weekends or after work. Or at least some online classes would make returning to school a lot more feasible, especially for those of us that have jobs and families and responsibilities. So at one time, only private options were available. So the University of Phoenix is a really commonly known one that was an online school that did alternative kind of weekend classes and stuff. But now actually state schools also offer online programs and are quite affordable. So for instance, the CSU system alone offers over 50 degree programs that you can complete completely online without ever setting foot in a classroom. And just so you know, there's a link to that in your handout as well if you want to see all 50 of those programs that you can do completely online through a CSU. So we're going to go about now, talk about paying for college, which is always a big question for everybody. So what you basically need to know is that financial aid comes in a few basic types, okay? There are fee waivers, grants, and scholarships. Those three you don't have to pay back, okay? Those are just free money. Then there's work study, which requires you to work in exchange for money. But it's usually something that's really flexible, like working in the bookstore or doing something that works around your school schedule. And then there's loans, which you do have to pay back. Some financial aid depends on where you go to school. For example, many students, especially those that receive SSI, qualify for something called Board of Governors fee waiver or other assistance that's specifically for a California community college. So I was one of the lucky recipients of a Board of Governors fee waiver that helped pay for my entire community college experience, and it was amazing help. So regardless of what type of financial aid you need, and usually people put a combination of these things together to cover all the costs, your first step is to go fill out what's called a FAFSA, and that's a free application for federal student aid. And the link to that is in your handout today. That will then let you know what grants, work study, and loans are available through the federal government and Cal Grants. Next, after you've done that, then you need to check with the financial aid office at your campus to find out about things like scholarships and other types of local financial aid that are only available through your campus or your department. Now, this is the exception I was going to tell you about earlier, like state school is usually cheaper and all of that. If you've got great grades, so maybe you've been in community college for a while or you just got out of high school and you did really great, don't rule out highly competitive private schools just because of cost. So like usually you think Ivy League and you think of Stanford in our area and it just seems completely out of reach. But if you've really gotten great grades and you've got a good application, in some cases there's special programs for exceptional students like you who are from low-income backgrounds. So for example, Stanford usually costs $46,000 in tuition alone. But if you're from a family that makes less than $125,000 a year, you get to go for free if you're admitted. And then if your family makes less than $65,000 a year, if you get admitted to Stanford, they'll not only pay for your tuition, but will pay for your food and lodging on campus as well. So it can be a really good deal. Of course, it's a very competitive program, so there's very few folks that actually get in there, but if you're one of those lucky ones, it's something to know about. So the bottom line is it pays to research the schools that you are interested in to find out what their financial packages are like. Lastly, the behavioral health care field offers some special loan forgiveness and stipend programs for people that meet requirements that are in high demand in the public mental health sector. And for that, we're going to have Kristen talk to you a little bit about those two programs.
Okay, thanks, Lisa. I've been fortunate in the last couple of years to have been involved in some of the early rollouts of some of these programs and have seen the great impact that they have in terms of really helping people out. Now, I kind of need to put a little piece out here, which is many of these programs are funded by the Mental Health Services Act, Prop 63 that some of you know, and some of this funding is sunsetting, so it might be going away in its original form. However, I think because some of these programs have been really successful and because of the incredible need that we have for behavioral health care providers and some of the current concerns, like say around the Affordable Care Act, I think we'll have opportunities to see some of these programs continue. So right now I'm going to talk about those that are in place and just let you know they're out there, and when time comes that you might be interested in taking advantage of them, I have the links there of places to explore so you can actually see what's being offered when you're ready. So the first thing I'd like to say is a little bit about the Mental Health Loan Assumption Program. And I've been in positions where I've helped people apply for them and written letter of recommendations, and later on got to review, not the same people of course, but different people review their applications, and it's really amazing kind of the story of lived experience that so many people bring to their jobs. And so it's great to see them, these folks, get some money back having taken out loans to pay for their education, especially because so many people are really adding so much in terms of diversity and skills to our workforce. So what I'd like to say about the, we call it the MLAP, and it's sponsored through the Office of Statewide Health and Planning Development, called OSHPD, kind of a cute little name. And again, this is funded by Mental Health Services Act money. And at this point, what happens with the loan assumption program is when you're in college, it's not uncommon, of course, to rack up some loans. And then some people have many thousands of dollars of loans. And then when they're done completing their training, and if they fund in a public mental health, because Prop 63 is about mental health funding, in a what's called a hard-to-fill position, then they can qualify. And hard-to-fill is defined by each county. So in some counties, they've actually made some peer positions hard to fill because they really do have a hard time finding proper people for those positions, people who are really qualified. In other places, it's like psychiatrists or certain types of, like, say, bilingual, bicultural staff, what have you. And that once the medical director in that county determines the hard-to-fill position, people can apply, and then they have the director determines if they're in a hard-to-fill position. It gets sent off to be reviewed. They need to commit to spending at least 1 year in a public behavioral health care setting, and that usually has to work at least part-time, but often full-time in that setting. And then you have like an application that's filled out. It's like about 4 very short, like a paragraph essay questions, in addition to some of your loan information, like how much it is and what you took out for. And then that loan application is reviewed. And what they've been able to do is they've been able to distribute several millions of dollars throughout California, depending on where people are in terms of the county they live in and such. They can get usually anywhere from, say, like to $7,000 to $10,000 in any given cycle taken off their loans, which is a good chunk of money. And then once you get it, you are often invited to reapply. So there's people who then sometimes get multiple cycles and actually have very large chunks of their loans paid off by this program. So it's a terrific program, and then once it's done, it's done. You don't have to pay that back. It's really, they are assuming your loan, which is really wonderful. Another piece that we have out there also being funded by the Mental Health Services Act at this point are stipend programs. And stipend programs are offered to people in certain professions. So how this came around is that in planning for workforce development in OSHPD, actually even before OSHPD, but for the Mental Health Services Act, different disciplines are needed throughout the state, and different representatives from disciplines kind of advocated for stipends for each of the specializations. And we know that, as Lisa just pointed out, different professionals have different duties that they do, and in certain counties and in certain regions, it's very hard to find a number of these professionals. So the idea is to really help boost the number of these professionals in our public mental health system throughout the state. So at this point, there are, if you look at the slide, there's Masters of Social Work, MSW, Marriage and Family Therapists, MFTs, Clinical Psychologists, that's a PsyD or PhD, and Psychiatric Mental Health Nurse Practitioners that can receive stipends. And depending on funding and how they design the program. Some years you can get more stipends in certain professions than others, and that each of the different professions have a slightly different requirements for their particular stipends. For instance, the Masters of Social Work stipends, a lot of students were able to receive those if they qualified while they were in their graduate program. It would help actually fund their training. For the marriage and family therapist stipends right now, the students are awarded the stipend like in their last year of training at their university, and then it's to help, they give it actually after people graduate to kind of help defray some costs of working, early in the public mental health system where people aren't necessarily making a lot of money as a pre-licensed person, but it really helps take care of some of their costs, and it helps them stay supported so they can stay in the field and get licensed. And it's a great way of adding resources to our public mental health system. So it's a real win-win. Like our public systems get some really good people, and that these really great people also get opportunities to be able to have stipends and support. So again, what I did is I put the link here to OSHPD, and again, if you just decide at any point to check out OSHPD, you can find a lot of information on various aspects of workforce development, including a lot of pieces related to peer certification and employment and training. But this link here is in particular to be able to look at, well, what stipends are being offered now, and what kind of resources are there available at this time. And I really encourage you to take note of that particular link. And I think that's all I have. Thank you.
Thanks, Kristen. Well, that is exactly right on time, because we wanted to have an hour of material and then allow for 30 minutes of discussion and questions, and you get a chance to reach out and tell us what more you'd like to learn about. So at this time, we're going to open it up to questions from the audience. Kelly is going to go ahead, and we're going to be, of course, entertaining questions from the entire presentation, those that have already been entered in the system, or if you have something that's come up for you following seeing all of this that you'd like to ask, please go ahead and type it in the question box now. And Kelly, if you can go ahead and read us the questions in the order that they've been received, and we'll go ahead and try to answer.
Okay, Lisa, our question that we have now is, what if you have some college, you've been working in the mental health field and have been working in the mental health field for 20 years, and also worked as a case manager and want to get a degree? What would be the easiest process?
So the question is, if you have been working in the field for 20 years and you've been doing case management in lots of different positions, you've got some college, but you'd like to get a degree, what's the easiest way to do that? Well, easiest really depends on the person, would be my response. What's easy to one person is not easy to another. So there are a couple things you might want to consider. One is, at times you can do examination for experiences. They can be called CLEP, C-L-E-P, or individual schools may allow you to challenge individual courses. Let's say if you've done something for a very long time and you think, I know the content of the course, you can sometimes take an exam and receive credit for the course just as if you took the whole course, if you pass the exam. So that's one route to kind of speed up that time to degree or make it a little bit less cumbersome. For me, I think the biggest way to make it more achievable to get your degree is an online or a hybrid program. I'm a big fan of those. An online program can be done whenever you have time, after work, on the weekends. You can take as few or as many units as you're able to do at that point in time. You can take regular live classes and that too as a supplement, but for a lot of people, online coursework makes it much more achievable to get that degree.
Okay, Lisa, right now we don't have any other questions in the question box, so we can pause for a few minutes to see if anyone else has any other questions.
I might add something too to the last to the last question, just about the fastest route, so to speak. I would also be curious of maybe doing some informational interviews of people in your office or who you work with, or just someone who might have a sense, maybe someone in the human resources department of where you work, just to get a sense of where the demand is in your area also, because that might help if you have a sense of all the different jobs that we've talked about. If there's some in particular that are really, where there's some need, that might help you also kind of figure out, well, where should I really target my efforts? Because quickly or shortly, however, that's kind of an important piece for sure, but also just thinking about, well, after you put some extra work in, what's really going to be needed, and what's the most worth your time and your interest, I suppose.
That's a great point, Kristen, and that made me think of another thing as well, which is if you're already employed in the mental health system, it's worth it to go talk to your employer about what type of needs they may have in the organization, and sometimes there's even support for giving you some paid time off to go pursue additional classes. If, say, for instance, they have a great need to move caseworkers, but they really need some LCSWs, maybe there's a chance that you could spend a part of your work week going to classes in your normal work week, or that sometimes employers even chip in a little bit of money to help defray the costs. So it's worth it, if you're already working in the mental health system, to have a conversation with your employer and see if there is any support for going back to school through your work. Do we have any other questions?
I have one that just came in, Lisa, so I will read this. Some positions have secondary requirements, such as having X amount of years of experience working in the behavioral health field versus having a bachelor's degree. Is it possible to look at a list that consists of these types of positions?
Okay, I don't know of any kind of it, and perhaps Kristen knows something that I don't know. I don't know of any kind of a concise list of these positions will take either education or experience. In my personal experience, and I could be off, and maybe there's something else that Kristen knows about, in my experience, it's a case-by-case basis with the job listing. So some organizations will say you must have a bachelor's degree plus X amount of years of experience. Others will say a bachelor's degree or equivalent on-the-job experience. But that usually varies from company to company, organization to organization, and position to position. And for all of the jobs that are quote-unquote clinical, meaning like a licensed clinical social worker, an LMFT, or an LPCC, psychiatrist or psychologist, those all require degree and experience and licensure. So those can't be waived with just commensurate experience in the field. So it would be other jobs like case management in some cases, or positions like that. Sometimes we'll accept work experience in lieu of a degree, but it's usually on a case-by-case basis.
Right. Yeah, I just had to add to that. That's really consistent with my understanding as well. And I even find that I think what impacts that is depending on where you're living. I think in some places where they're more isolated, or where there's less formal college access, although that's changing some with the online options, you're more likely to have work experience substitute for education. I think especially in the Bay Area, I think there's less of the work experience counting for education. But
Yeah.
But again, don't rule that out. I mean, you can always check, but it is definitely a case by case, and checking with human resources listing at the place that you're interested to work.
Okay, next question. What job opportunities do you know of that require just MA counseling or an MFT? TI?
American Family Therapist. Yeah.
So did you say MFTI? Is that what the question was?
Yeah.
It looks like it, yeah.
Okay, so if I'm understanding correctly, an MFTI is Marriage Family Therapist Intern, which means somebody who has graduated with their master's degree, but they don't yet have the hours that they need accrued to sit for licensure. So that means that person is still being supervised by a licensed MFT or licensed psychologist. So in terms of what job opportunities are out there for MFTIs or people that have finished their master's degree but maybe don't even have the MFTI standing, you know, there's a lot of different places that you can work. I was in this situation for a really long time because it took me 6 years to get my hours for licensure. I was slow at it. One place that I have many friends that work that have a master's in counseling but don't have any licensure is in within universities, in counseling departments in universities, doing career counseling, doing academic advising, working in the disability resource centers, helping people to get accommodations for their class and deal with the stresses of life in college. That's one setting that I know a lot of folks have found. And then as an MFTI, you can work in many settings as long as you have a professional licensed psychologist or MFT to sign off on your hours.
Okay, thank you. I think that is it for the questions.
Okay. Well, if there's no more questions, then just quickly I'm going to pan through. If you got the email or the handouts, you'll see that there's these slides with additional resources. Kelly has so kindly put those all into one handy little sheet for you guys so that you can do some more investigation on your own. I want to point out a couple of them here. Recordings of the webinars like today's, upcoming and past trainings and resources. Be sure to visit the PLI webpage on mentalhealthworkforce.org. There's additional resources on mental health careers here for you to take a look at in more depth. This link is the link to apply for multiple California Community College campuses all in one fell swoop that I was talking about earlier. This, in the same way, you can apply to multiple California State University system campuses in one fell swoop. This is the FAFSA, and that's the first place that you have got to go if you want to get financial aid. So if you're even thinking about going back to school next year, go to the FAFSA.ed.gov website and fill it out. Make sure you get it done before January so that you can get your federal aid for next year. Online CSU degree programs are listed here if you're interested in getting some online coursework. And that is our show for today. I want to thank everybody for all of your questions. Those were really great. We're at the end of our time now, and thanks to you in the audience for attending. Once again, we encourage you to take a few moments to share your feedback as you exit the session. And if you have not done so already and you had multiple participants in the room, please indicate the number of the participants, the organizations that they work for, as well as their county so we have that data. And with that, we are going to go ahead and conclude our broadcast. Thank you again for joining us.